Hey everyone, today we're going to tackle why you should not sleep on your stomach. I have many videos on how to sleep with sciatica, headaches, pinched nerves, dizziness. Check those out, but this one is for those that can't not sleep on their stomach. I'm going to tell you why it's bad for you and how you can change that habit. Let's get to it. Sleep position matters. Your spine houses your nervous system that controls your body. So when your spine is not supported properly, it can cause unnecessary strain not only on the spine causing pain, but on your nerves as well. We need to consider what normal is. Normal, when we're standing upright, we have these smooth curves, a cervical lordosis, a thoracic kyphosis, and a lumbar lordosis. These curves are very important to help maintain the integrity of your spine, allow you to move properly and function your day-to-day life. The other most important thing we look at is when we look at you from the front. We want to be as straight as possible. We don't want any hip hikes or any curvatures in the spine because it does the same thing. It stresses the spine and the nervous system. I'm going to walk through the why you shouldn't sleep on your stomach with this model spine, and I'm going to show you the how not to. I think you're going to like it. Let's start with what happens to your spine when you are on your stomach. When we flip over, obviously we can't keep our face down because we'd smother. So what we have to do is we have to turn our necks. And so right away, if you're sleeping with your neck turned like this, it's adding a massive amount of stress and strain to it. It's gonna wear the joints down quicker, it's gonna stretch ligaments and muscles, it's gonna irritate nerves. Over time, you might be able to get away with it when you're young, but as you get older, you will not be able to do this. The problem is this is not where it stops. As we work down the spine, if we have a soft mattress, you can see that our bellies will push down, and that can cause a hyperextension in our lower back. That irritates the facet joints. Again, you're gonna wake up with pain like that. And then finally, there's no way that you're gonna sleep with your pelvis in alignment. What's gonna happen, it's gonna twist and hike up. You're creating this biomechanical disadvantage to your spine that's putting unnecessary stress over the night. And yes, as I say, you can get away with it when you're younger, but as you start to get older, these joints are less flexible, they're less tolerant, and you will not wake up feeling fine. And I'll boldly say that it will decrease your quality of life if you sleep like this, because it's going to decrease your mobility and increase your pain. The opposite thing is if you have a bigger belly at the front, then what's going to happen, it's going to cause a flexion because it will not sink into the mattress, and you're going to put pressure on the discs. This is going to add premature wear. It could cause weakness in the disc, which can lead to disc bulges or herniations. Not something you want to deal with. So the question is, how do you change the habit from sleeping on your stomach to either on your back or your side? Well, that's what I'm going to show you next. Now, I won't sit here and tell you it's going to be easy, but I can tell you it's going to be worth it. If you can switch your tummy or face sleeping to either a side or back position, it's going to improve your quality of life significantly. Now, we know this is possible because pregnant women do it all the time. In fact, my wife was a stomach sleeper until she was pregnant, and then she was able to learn not to sleep on your stomach. So we need to try to emulate, well, how can we allow you to change a habit without having to think about it much? So there's two things you need to do. One, the first thing is an easy thing. You take a pillow, and it's very simple. You're going to place it between your knees. And obviously you'd have a pillow here. Now, the good thing about this, it stabilizes your lower back. It doesn't allow you to rotate over, and it just prevents you. It's harder to roll on your stomach when you have a pillow between your knees. Now, I'm sure some of you have tried this. There's a next level tip I'm gonna give you right now. The next thing you can do, it might be a bit drastic, but it actually works. Get a shirt. It could be like an undershirt or thin shirt that has a pillow on it. Find a ball. You got it. Put it right here. Try sleeping on your stomach with a ball in the front of your pocket. It doesn't feel good, and it's going to remind you to either get on your side or get on your back. This little hack might seem drastic, but I can assure you your future quality of life and how you move and how you feel is dependent on you sleeping properly, and that involves not sleeping on your stomach. It takes persistence and consistency to change this habit, but I know you can do it. Your future quality of life will thank you, your spine will thank you, you'll feel better, you'll be more mobile, and you'll be more active and be able to do the things that you like to do in life without any limitations. I hope you found this helpful. If you did, give me the thumbs up to show some support. If you're new to my channel, maybe you consider subscribing so you can be informed when I upload new videos just like this. Thanks for tuning in. Go get your t-shirt with pocket and a ball and start your habit change today. Can't wait to see my next video. Until then, sleep well.